Morning. My name is Dr. Sidney Mpisa. I work in the GI unit at the University Teaching Hospital, Lusaka, Zambia. Today I want to talk about hepatitis B. What is hepatitis B? So hepatitis B is a viral infection which commonly affects our liver. And the common question is, how do I get hepatitis B? So commonly hepatitis B virus, you get it from body fluids, commonly during sexual contact, sweat, and some patients mainly during delivery. So what we have seen is hepatitis B, we have coined a statement that hepatitis B runs in families because it's mainly transmitted from the mother to the child during delivery. So once you see your sibling is tested for hepatitis B and they are positive, we encourage you to go and get tested also. That's when you see most of the people in the family who also test positive. The challenge with hepatitis B is most of the people, they don't have symptoms. But you might ask, what are the common symptoms? So for hepatitis B is most people, like I said, they don't have symptoms, but those who have symptoms, they have symptoms of liver disease. Hepatitis B virus will cause fibrosis of your liver. So what are the common symptoms of liver disease? Yellowing of eyes, just feeling tired, and at times abdominal, your stomach becomes swollen, and your legs also become swollen. The worst is you can get a liver cancer. The question is now, how do I get treatment, and what is the treatment and what is the outcome? The treatment of choice is we use ARVs. The ARVs which are used for HIV treatment are the same drugs we use for treatment of hepatitis B virus. Commonly we use tenofovir and lamivudine in our setup. And the common questions patients ask is, how long should I take the treatment? So it's lifelong treatment. Most patients, it's lifelong. We don't mention that you are going to stop because the chance of you stopping is very minimal. Very few patients, about 1% chance per year of you becoming negative for the hepatitis B virus. The common questions we get from patients is, when my partner tests positive, should we continue living as husband and wife? Yes, you should. There are ways to prevent transmission of the virus especially if you're a discordant couple. You can use protection, but the number one thing we recommend is let the partner who is negative be vaccinated. And you can actually test if the vaccine you got is effective. You can come to the GI clinic at UTH. We can guide you. The other question we get from employers is, if my employee is hepatitis B positive, what should I do? Should I fire them? No, hepatitis B patients should live a normal life, should be allowed to work, should be allowed to do the normal things in life. Once they are on treatment, the viral load goes down, the risk of transmission is very low. So they should be allowed to work, they should be allowed to live a normal life. Then the other common question for ladies is, should I be pregnant? And if I get pregnant, what's the chance of my baby getting the disease? So now there is drive for a hepatitis B vaccine birth dose. Once your baby is delivered, within the first 24 hours, ideally within the first hour, the baby should receive a vaccine. In other centers, you can even buy an immunoglobulin for the hepatitis B virus. That has been shown to help prevention of transmission, the virus from the mother to the child. So we have lots of success in our maternity unit there, where mothers with hepatitis B can actually deliver an hepatitis B negative baby. The other question, which is very difficult to answer, is most patients will come asking us, so who gave it to me? At times it's very difficult. What I can say is, if you get the virus as an adult, there are 90% chance that your body can clear it. And you might clear the virus. When I say clear, it's you got it, then you become negative without you even knowing. But there are some people who can become positive, then they become ill with yellow eyes, dark urine, Some can go even into some confusion, but that's a very small percentage, about 1%. So it's very difficult for us to know who gave it to you. Most of the patients we see in clinic, it's chronic hepatitis B. When we say chronic, you've had the virus for more than 6 months, and likely you would have gotten the virus in your childhood. Why we say childhood? It's because we know that in childhood, especially around delivery, if you get the virus, then there is only 5 to 10% chance of you clearing the virus. That's because your immune system hasn't really developed. So most of the people we see, that's why we then say when you test positive, we want your parents, your mother, the people you grow around with, to also get tested, because likely that's when you got the infection and you could not clear the virus. So where do I get help? At the University Teaching Hospital, we do hepatitis clinic every Friday. It's an adult center of excellence. If you just come there is a hepatitis clinic. There's a good team which is managing hepatitis patients, and we have expertise. So I encourage you to come. Every Friday we are there. Just come and get assistance. Thank you.